In learning is when we actually create our growth, and learning is stimulated by a challenge that we are wanting to overcome. Hi, today's video is going to be an interesting one. It is going to be a video that demonstrates our need as human beings to learn, because in learning is when we actually create our growth, and learning is stimulated by a challenge that we are wanting to overcome. The video that I'm going to show you today involves how technology is blending with surgical skills to create better outcomes for our patients. See, when I was in medical school and when I was training to be a surgeon, the instruments that I used were very rigid. They were like tools that you could buy in Bunnings. If we took the example of a needle holder, it was like a rigid piece of metal which would grab the needle in it and you would use that to stitch. As the need for innovation and desire for improving patient outcomes progressed in surgery, we came up with keyhole surgery, which was laparoscopic surgery. In laparoscopic surgery, we'd be using these long chopsticks type instruments, which were still rigid, but they had the ability to go through very tiny holes, and we call them ports. That was a big leap from open surgery to keyhole surgery. But as our requirement or our learning potential kept growing, we went on to robotic surgery. In the robot in 1999, Da Vinci, which is the name of this company that invented the surgical robot, it created this big expensive piece of technology that would allow us to rotate the instruments and the needles in a way inside the abdomen, and this could be in any body cavity, such that we are in a position to create the outcomes that we look for with the minimal amount of discomfort, but it still had its own learning curve. The big disadvantage of robotic cases was that the big price tag attached to it. It was almost 2.5 million US dollars to have this surgical robot. Now, a good middle path that has now come in the market is a piece of technology that I recently used, and that is called the FlexDex. What I really like about this technology is that it is just like a piece of instrument that can be put through our standard keyhole ports for laparoscopic surgery, but it's got this contraption through which the surgeon puts their arm, and the beauty is that as the arm is rotated, as you can see, it causes a rotation, a full 360-degree rotation in any direction of the tip of the instrument. The beauty of this instrument is that the joint of the instrument from where its fulcrum is located is co-located with the human wrist. So when the surgeon is putting it into this special groove or the handle that has been made, it can actually imitate or replicate the movement of my hand exactly at the tip. This was a great piece of technology that I used because it was inexpensive. It did not need massive pieces of machinery such as that required in the robot. And I could use it with minimal sort of training and orientation for myself and for my team. I did need to go through at least 2 to 3 days of training on this instrument, but that was not as much or not as extensive as it was for the robot. I recently used this instrument in an operation for esophageal cancer removal in one of my patients. This is a very complex operation which is done in 2 parts. We do it from the abdomen and then we do it through the chest. In the abdomen, we make a conduit, which is the tube of the stomach, which replaces the part of the food pipe that we are removing. We almost remove about 2/3 of the food pipe because this patient had esophageal cancer, and that is the reason when we remove the food pipe, we have to replace it with something else. So we replace it with this gastric tube, or it's called a conduit. Now, when this conduit is taken up in the chest, it creates a unique challenge. The challenge is that because the ribs are bony structures, the range of movement of our keyhole instruments is very limited. This is because the chest part of the surgery, we do it as keyhole or thoracoscopic procedure. When we came across this instrument, the FlexTex needle holder, the beauty of this instrument was that in the chest, I could move this instrument in any direction to do the suturing, because this conduit has to be joined to the upper part of the food pipe, which is healthy, which stays in the patient. And that is where I found a specific advantage of this FlexTex instrument. And this may be more technical information for some people, although it is still relevant because there is still a learning curve that needs to be overcome when this instrument is being used for an esophagectomy operation. The three challenges that I specifically faced while doing this surgery in the chest was, number one, the ports that we use in the chest are somewhat floating. What I mean by that is we don't create a pneumoperitoneum like we do in the abdomen. There was nothing like that, and the ports were not hugging the instrument to give it some stability. So in the video you can see there's a little bit of a tremor. So that was something that I had to self-correct. The second thing was that there was the conscious effort on my part to remember to keep the elbow of the instrument parallel to the tissue that I was suturing. The black part of the instrument has to be always kept parallel for us to get the right angle on which we pass the needle through the tissue. And the third aspect was to actually consciously remember that the needle should always be held perpendicular to the jaws rather than how we hold the needle in a rigid needle holder. We would sometimes hold it at an angle. There is no need for it to be held that way because FlexTex allows you the flexibility and the dexterity to be able to move the needle in any direction. Those were my three key challenges that I had to kind of consciously remind myself when doing the surgery. My patient had an excellent surgical outcome, and I'm grateful for the technology that allowed us to enhance our surgical skills to provide that outcome for the patients. My question to you is, where is it that you are learning? Where is it that you are growing? Or what specific challenge are you overcoming with whatever you are learning? Do share this with me in the comments, because I love to associate with learners, people who are always wanting to learn and grow and ultimately to be of service to others.